guys, so today we're going to talk about BiPAP and CPAP basic settings on the Philips V60 machine. This machine is already on at the moment and we are already in BiPAP mode. You can see the active mode is S/T, so that's spontaneous/timed, which is BiPAP, but BiPAP is trademarked. So, basic settings, we have inspiratory pressure, which is the peak pressures achieved on inspiration. You can change this setting by pushing the dial up or down to your desired setting and pressing accept. Next, we have expiratory pressure, so that's your PEEP. This one again, you can select and change the PEEP according to the doctor's setting by putting the arrows up or down and hitting accept. The next setting is a backup respiratory rate. This machine should be used for spontaneously breathing patients, but as a backup, you can set the rate so the machine alarms when the patient drops their respiratory rate. Once again, select and change the by moving it up or down and hitting accept. Next is your inspiratory time. You can select this one and change it to your desired time. Patients who are asthmatics, you would want to look for a shorter inspiratory time and longer expiratory time. So adjust that as you need and hit accept. Lastly is your fraction of inspired oxygen. Select this one and you can change it by moving the dial up or down. We like to suggest that all patients start on 100% O2 and then you wean them down, unless otherwise indicated. Then select accept. Now we'll just move on to having a quick look at the selections for CPAP mode. Now you can see the active mode is CPAP. We have less options here because this is just one continuous airway pressure, not bi-level. Firstly, you'd select your CPAP pressure. This is your PEEP. So ask the doctor what they would like and dial up or down. You physiologically have a baseline PEEP of normally 4 centimetres of water, so you cannot go below 4. And be mindful of not causing high pressures at end expiratory by selecting anything above 25 and hit accept. And lastly, select your percentage of inspired oxygen. Move that one up or down. Once again, we like to start with 100% O2 unless otherwise indicated, and then wean the patient off it. Hit accept. That, in a nutshell, is the very basic settings for BiPAP and CPAP.